There is a new initiative from Medicare. I shouldn't call it new. So Medicare has always had on their books as a HCPCS code, home accessibility, right? And not necessarily the actual repairs or the modification, but to do an assessment of the home, because how somebody lives is extremely important to the medical community. Whether there's mold, sufficient lighting, fall risk, you have a knee surgery, how you getting back in the house. I mean, historically, the medical community has just gone through and, they replace your knee and good luck, go home.
Is it true that it's cheaper to keep listeners in their homes safely than transition them into assisted living?
Absolutely.
Okay.
You'll save 10 to 20 times the cost of going into assisted living. And it's already a proven fact that people live 15 to 20% longer staying in their house.
So the listeners, they're like, oh, this is another government program and da-da-da-da. Nope. It's a good government program.
No, and it's one that's always been on the books, but
nobody knows about it.
Because Medicare never paid for it. It was on the books, and you could actually make it part of the medical history. And it has to be a doctor, an OT, whatever, that has to go out to the home and actually do the assessment. But now, starting in January 1st, 2026, they're paying on that code because they want the doctors to.
Wow.
Yeah, well, they're planning ahead because by 2030, the last of your baby boomers are turning, are
Sure.
aging out, and the Gen X is coming through, and starting to age into 60 plus. So we have the first time in history we're going to have a large population, elderly, retired, who need extensive medical help or assistance.
Sure.
And we have a very small, younger population under the age of 25 to pay into Medicare and Medicaid and Social Security to allow these people to have the benefits.
So how do our listeners take advantage of that?
Talk to your doctor. And again, it doesn't start till January 1st, so talking to your doctor now is kind of a waste of time. But it starts on January 1st. If your doctors have any questions on it, we have some information on our website. We could also point them in the direction of how they can bill it. But the big thing here is that now how the doctors will know the environment that you live in, and then they can actually make better decisions on how we're going to keep you in your house. So if we give you this knee surgery, you have 7 steps to get in your house. We need to make sure you can get into your house after the surgery. We just can't send you home. Not necessarily that insurance or Medicare is going to pay to, put in the lift or whatever, but at least the doctors are aware of it and they're not sending people into an unsafe situation.
Does Medicaid pay for in-home health care that could cost up to $300 to $400 a day instead of transitioning our listeners into assisted
There
living?
is a certain amount, and I'm not a pro at this, so somebody better out there can call in on it. But it really depends on your disability. It depends on your specific needs, and there are a certain number of hours that you can get for home care assistance. And sometimes it's nursing, sometimes it's just somebody coming in and cooking,
Sure.
and helping you with laundry and stuff. I'm more familiar with the Medicaid than I am the Medicare part of that.
Okay.
But, Illinois has a really good program to help people that need it.